Hello, I'm Fabienne Dobbels. I'm a psychologist and psychotherapist, and I have clinical expertise in the domain of cardiology and transplantation. And after my PhD journey and also having worked as a postdoctoral researcher, I became a professor full-time here within the Department of Public Health and Primary Care. Our research group belongs to the Academic Center of Nursing and Midwifery unit within the department. And in my opinion, our research is very much in line with the mission and vision of our department. A first major health concern we tackle is medication taking behavior, medication adherence. We know that many people suffer or have difficulties to follow often complex medication regimens, and this may have serious clinical consequences, economic consequences, and also impacts people's quality of life. In our work, we try to understand what influences medication taking behavior, and we also try to test out interventions to support people in better adhering to these complex medication regimens. Our interventions not only focus on the patient, but also try to incorporate the healthcare professionals by looking for ways how they can support this, offer training on behavior change principles, so that this really has an impact in the clinical practice as well. The second line of our research is focusing on enhancing or improving models of care for people with chronic conditions. Traditionally and nowadays, many healthcare models still focus on medical aspects predominantly. It's of course important to pay attention to symptoms, comorbidities, the pharmacological management of a disease. But people living with a chronic condition also have many other non-medical needs. How to cope with having a chronic disease, how to deal with emotions coming along with having a chronic disease, what is the social impact. Some people also have to change their lifestyle. So how to do that, leading a healthy lifestyle, and also how to adhere to this medication adherence. So in our work, we try to develop chronic care models that not only incorporate these medical needs, but also pay attention to the non-medical needs. We again try to find ways how to capture these non-medical needs, for instance, by using patient-reported outcome measures. But at the same time, we also look for ways how care can be better adapted to also deal with these non-medical needs. So in other words, it comes down to trying to find successful interventions that help people to better deal with having a chronic condition. Our work is rooted within the field of transplantation. This is where it started, but gradually our work is expanded to other fields of chronic conditions, including people with rare chronic diseases. Also, patient involvement recently became a common thread across our research. And we don't mean with patient involvement participating in research, patient engagement. No, we truly mean patient involvement. And perhaps I can illustrate this best with one of our projects we recently completed. So we coordinated the COCOS IPF project, which is funded by the European Joint Commission on Rare Diseases, and in which we aim to co-design a core outcome set for, but also with, people living with idiopathic pulmonary fibrosis or progressive pulmonary fibrosis. These are rare lung conditions, often affecting older people, mostly men, and it comes with debilitating symptoms and has a significant impact on life expectancy and quality of life. So within this project, we very closely work together with patients or their representatives, and they are full partners within research. So they have expertise that has added value to the expertise we have as traditional researchers. So they were involved in all aspects of the projects, and we empower them, we equip them to take the lead in conducting part of the research themselves. For instance, setting up focus groups with patients in different European countries. And this resulted in the creation of a core outcome set, the key outcomes that should be addressed in routine clinical care for people with progressive pulmonary fibrosis across Europe. And we would never have accomplished this or have ended up with the same set of outcomes that mean a lot for people living with the condition, but also for health professionals, without the active involvement of these patients or patient representative experts. The first driver is curiosity. That's perhaps a no-brainer. Many researchers would say that curiosity drives their research. But I've always been curious about how people behave and why they act as they do. And not surprisingly, this probably explains why I became a psychologist and why later on I became so passionate about one type of patient behavior, and that is medication adherence. A second driver is collaboration. I very much enjoy working together with colleagues on a local level, but also internationally. And this can be on research projects, but also on consensus documents, on educational projects, and so on. And perhaps the most fulfilling group to work with is the younger generation. I like mentoring younger people and I learn a lot from them. And it's very fulfilling to see them grow and also thrive as a young researcher. So I like to invest in the next generation of successful researchers. It's like teamwork makes the dream work, to say it in other words. And then a final driver I would like to mention is the impact we have with our work on direct clinical care. It's not, we are not able to change the world, of course, but what we do makes sense for clinical practice. So if we identify successful intervention, for instance, to improve medication adherence, this can be directly implemented in routine practice. So it makes sense to see the benefits of what we do to improve not only medication adherence behavior, but also to improve the emotional coping with the disease or reduce the burden of having to live with a chronic condition. So I try to catch a stone across the waters without making huge changes, but the impact we have on a significant group of people and chronic conditions makes it very valuable to continue working in these fields of research. So this is all about me, but I'm sure if you have other questions or want to contact me to discuss potential collaborations or want to learn more about our work, you're of course very much welcome to contact me via email, and you can find my contact details on the website of our department.